Welcome back to the show, Talk with Your Talk. Today with me is Dr. Sanjay Azad, and we are talking about malignant skin cancer, which is melanoma. We just talked about what are the risk factors for the melanoma, and as you mentioned that anybody in any age can get the melanoma, but people in the older age tend to get melanoma. We talked about ultraviolet radiation causing a risk factor for the melanoma, and tanning saloon can be a risk factor for developing melanoma. Can you please tell us about the people with the skin color, people, especially Caucasians, white people, what is the incidence of melanoma in them?
So the darker skin is more protective, and if you're fairer skin color and you tend to burn easily rather than tan, then you're more prone to developing this condition. So it's important that fair-skinned people look after their skin because just the nature of the skin itself.
So after 50 years, white people more exposed to ultraviolet radiation or sun rays, all these are risk factors for melanoma. So how can we prevent development of melanoma? What precautions one should take so that this bad type of skin cancer is not found in oneself?
So I think there are two main areas which would help in this. One is being aware of the sun, and the second is being aware of your skin.
Right.
So the sun awareness is, we know that sun is is something which we all desire, but it's not really good for your skin. So exposing your skin for too long or getting burnt is not a good idea. So the application of sunscreen, at least factor 30, is a good thing. And if you're going into water, then you must follow the recommendations for applying sunscreen more frequently, virtually every 2 hours. Before you leave the house, apply it half an hour before, and then make sure you cover all exposed areas. And some areas which are not covered by sunscreen typically are sort of the areas, particularly the hands, the neckline, and sometimes the feet. So these areas, people will cover the face, but not those areas. So make sure that you have sunscreen application on that. Then put on a large hat, cover your arms with sleeves, and basically be sensible in exposing yourself to sun and avoiding a sunburn.
So sunscreen lotion, protecting yourself against the ultraviolet radiation of the sun, which is very important. Now melanoma can also develop in the eyes, and what would you like to say about precautions for developing of melanoma in the eyes?
But you can wear protective sunglasses, which are UV stable. So that would be something for you to consider, and that would be helpful as well.
Right, and finding the melanoma in the children, what sort of precautions one should take?
So for children, again, make sure they have sunscreen on. If they are going out into water, then there are sun protective swimsuits available. Looking at that, reapplication of sunscreen on a frequent basis, especially if they're getting wet. And as the child grows up, making them aware that sun exposure is good in one way, but they shouldn't get sunburnt.
Yes. Now, is there any role of family history? Somebody's family has a melanoma. What are the chances that we can get a melanoma?
Yeah, so there is there are genetic traits and mutations which can happen. So if there is a family history of melanoma, then certainly there is a higher chance of you developing melanoma. So being more aware of it.
Right.
And what I've seen is that generally people who've got melanoma in their family are much more skin aware, and they come forward much earlier.
Right.
So that's all a good thing.
So one having a family history or having multiple pigmented lesions, brown or dark colored lesions on the body, one should be extra cautious and avoid these risk factors. Otherwise, chances of developing melanoma are higher.
Absolutely. So basically being very aware, much more aware of your skin.
Right.
Because this was not something which was highlighted maybe 30, 40, 50 years ago.
Yes.
But now it is becoming more and more common to see this condition.
Right.
And I think everybody should look after their skin in every possible way.
Right. Now, how one can detect melanoma at early stage? What are the signs and symptoms? How one can diagnose it and make it sure that it is detected and treated at early stage? So what precautions one should take?
So you're basically looking at any skin lesion, and we normally call it the A, B, C, D, E. So A stands for asymmetry. So it means that any lesion which is looking different, if you draw a line through it, it looks different on each side. So that is it's asymmetrical. If the border is getting irregular of that particular lesion, then that is also suspicious. If the color is changing, so let's say you've got dark and lighter areas in any skin lesion, then that is also suggestive that it could be a melanoma. And if it's increasing in size, let's say it is going beyond sort of 5-6 millimeters in diameter, then that is also suggestive that, look, this could be possibly a melanoma. And if it's evolving a lot, so it's changing, it bleeds or itches, those could be additional signs as well.
So one should self-examine himself or herself regularly and look for any pigmented lesion having these features what you just mentioned, that asymmetrical lesion, irregular borders, changing the color, or increase the dimension of the lesion. All of a sudden the pigmented lesion changes its size, or there is an enlargement of the lesion, then one should approach a doctor. Is that right, what you're saying?
Correct. So just basically being aware of your skin and examining yourself with good light at home, getting your friend or family to help you on areas which are not accessible, like the back,
Right.
and then looking at it and then moving forward from there. And if you feel that anything is in this category which you don't like or looks suspicious, then please approach your doctor straight away, and then an appropriate referral will be made for the patient, for you.
So the mole, which is a benign or a good type of pigmented lesion, and the melanoma, which is a bad type of pigmented lesion. So what will be the characteristics of a good type of pigmented or mole? How does it look like?
So mole, the color can be brown or tan colored, or even sometimes is darker, but the borders are very, very irregular. The color is very similar throughout the mole. There's no bleeding or itching in the mole, and it's not changing.
Right.
So it just remains static. So if you got a mole, if you got any lesion which has got those sort of characteristics, then you know that, look, this is probably just a benign condition. But do not wait. If you've got any doubts,
Right.
get it checked out.
So mole is a small lesion, like say 6 millimeter or less?
Yes, so they can be in different sizes. I mean, these dimensions have been given so that it focuses attention on
Right.
an area. But any lesion which you think is small and is not evolving, then it is probably a benign condition.
Go to the dermatologist or to your family doctor and get it evaluated.
Correct.
If the lesion is looking irregular or becoming bigger in size.
Absolutely.
Thank you so much. Please stay back and we'll come back to the discussion after a short break.